This conference will now be recorded.
Hello, is my voice clear?
Yes, your voice is audible, yeah.
Is it clear now? Hello.
Yes, your voice is
Yes, clear.
Okay. Assalamu alaikum, everybody.
clear.
We'll continue today, inshallah, our module of the antenatal and the maternal medicine. In the last session, we take 5 cases of the antenatal and the maternal medicine, and as we said, we have a different case and a lot of case of maternal medicine. In the last one, we take a case about small for gestational age baby, and another case was for a patient with a large for gestational age. The third one, it was for a patient with Graves' disease, pregnant patient with Graves' disease, and came for her antenatal care, and they said this was in the last exam. We take also a case of a teenager patient, a teenager pregnant with diabetes. And we take also a patient with previous one cesarean section, and she came pregnant and discussing the place of her delivery. She want to home birth. Today, inshallah, we'll complete our module. We'll start by case number 6. So, who wanted to share with us today?
Can I try it?
Okay, Aisha, welcome.
Thank you.
Okay, I will adjust the time for you.
Spina Bifida and ventriculomegaly.
But your voice is too low, Aisha.
All
Can you
right.
raise your voice?
Okay, I'll just see where the problem is here.
Okay. Now, Aisha, I will adjust the 2 time for you. Okay?
Okay.
2 minutes for you. Okay,
Okay.
yeah, start.
Okay. Okay.
Okay, 2 minute finish.
Okay.
Now we'll start 10 minute.
All right. Okay.
Okay, start please.
Okay. Hello, I'm Dr. Aisha, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yes, my name is Sarah Smith, doctor, and I am 22 years old.
Mhm. How would you like me to address you, either with your first name or last name?
Call me Mrs. Smith.
All right. Mm. So, Mrs. Smith, I understand from your notes that you're into your first pregnancy and you're 21 weeks into your pregnancy, and today you are here. I am here today to discuss an ultrasound report with you. Is that right?
Yes, doctor. Yes, really, I did my anomaly scan, and I wanted to know the result of my scan.
Mm-hmm. All right. Okay. Apart from this, Mrs. Smith, do you have any other specific concern that you would like me to address for you today?
No, no, no at all, doctor.
All right. So, Mrs. Smith, before I discuss the test ultrasound results with you, is it okay if I can ask you a few questions to know more about you as we are meeting for the first time?
Yes, okay.
All right. May need to examine you in the presence of chaperone and then would run some tests you, and then together we can discuss your results and the further management accordingly. All right.
Okay, doctor.
Okay. So, Mrs. Smith, can you tell me how is your pregnancy going on so far?
Yes, my pregnancy is normal. Everything is okay, and I did my routine test in the start of my pregnancy, and all was fine. And I did also my Down syndrome screen, and they told me that my baby is normal, and everything is okay.
That's good to hear. And apart from that, have you named your baby?
Yes, Tom.
All right. So, how is Tom doing? Is he kicking inside your tummy?
Yes, he is kicking many time.
Mm-hmm. Okay. And apart from this, Mrs. Smith, as I can see from your notes that this is your first pregnancy. Have you ever been pregnant before?
No, no at all. It's the first one.
Mm-hmm. Okay. And what about your cervical smears? Are they updated and normal?
Yeah, I am 22 years old, doctor. Still,
Okay.
I don't have any invitation till now.
Okay. All right. Okay. And are you following with your GP for any other medical problem like diabetes or hypertension or blood clot?
No at all.
Mm-hmm. Any operation on your tummy or down below?
No, no at all.
Hmm. Any family history of concern that you would like to share with me?
Only my mother has hypertension.
Mm-hmm. Is her blood pressure under control?
Yes,
Ma'am?
she is okay. Yes.
Mm-hmm. That's good to hear. Okay. And are you taking any medications at the moment?
Only vitamins of pregnancy.
Mm-hmm. And did you took folic acid, Mrs. Smith?
Yes, I took folic acid 400 microgram.
Mm-hmm. Okay. And are you allergic to any medication or food substance that you're aware of?
No, no.
Mm-hmm. And do you smoke?
Occasionally.
Mm. Use of any recreational drug
No,
or drink alcohol?
no.
Mm-hmm. And with whom you are living, Mrs. Smith?
And with my partner.
Mm-hmm. Do you feel safe and happy with him?
Yes, he loved me so
Mm.
much.
That's good. Mm-hmm. And what do you do for your living?
I'm a teacher.
Mm-hmm. Okay. And in the past 4 weeks, have you ever been bothered by feeling low down or depressed?
No, at all. I am very happy with my pregnancy.
Mm-hmm. In the past 4 weeks, have you ever been bothered by feeling lack of interest in activities that usually used to enjoy before?
No, at all. No.
And do you know your blood group, Mrs. Smith?
Yes, all positive.
That's good. And your BMI?
Yes, it is the 2022.
All right. Okay. Thank you, Mrs. Smith, for sharing all your information with me. Is there anything else that you would like to add?
No, doctor. I wanted to know the result of the scan.
All right. So yes, Mrs. Smith, I'll just come to the results. Just before discussing the test results with you, is it? I'll just confirm your name and age. This is Mrs. Sarah Smith, 22 years old. Is that right?
Yes.
Before we discuss the result, Mrs. Smith, would you like to call someone to be there with you?
No, doctor. Why?
Because Mrs. Smith, the ultrasound report has some concerns. So before that, would it be okay if you would, or can I continue?
Yes, okay, you can go on, doctor, please.
Okay. So Mrs. Smith, it shows the result has some concerns. The ultrasound report shows that it's a single alive baby with 20 weeks, 20 or 21 weeks into your pregnancy. But however, I'm really sorry to tell you that the result shows that that your baby has a spina bifida and ventriculomegaly. Have you ever heard about it before?
What is spina bifida, doctor? What does it mean?
Yes, Mrs. Smith. Would it be okay if I can explain you in a bit detail about it?
Is my
Mm.
baby okay, doctor? Please assure me about my baby. I'm very worried now.
Yes, Mrs. Smith. Let me explain you what this means. Basically, these are the two different conditions that your baby is having it. That means let me explain you with the help of a drawing. This is the baby's brain, and there is a usually we expect a little amount of water around the brain of the baby, but in your case there is excessive amount of water around the brain of the baby, and there is also an opening on the back of the baby. Because of this increased water, it is causing excessive pressure on the brain, and then because of that, it can lead to some of the brain damage as well.
Oh my God.
Am I,
Oh, my baby Tom. Why this happened, doctor?
Mrs. Smith? Sometimes really we don't know why did it happen or what could. But as you told me that from the history I asked you, I couldn't find any of the risk factors that made you on having an increased risk of having this condition. But sometimes a woman can have this in condition for without any reason as well.
Oh my God. So my baby has a defect in the back. He can't walk at all.
Mrs. Smith, it is really very difficult to tell you at the moment because the condition of spina bifida is not able to show its full effect till after the delivery. But generally, it depends where exactly the location of the spina bifida is and what is the size of the defect. If the defect is small, the effect may be minimal. But if it's a big one, there's a chance that the nerve may be damaged. For that, in the long
Oh
term,
my,
the baby may need a special need. That means he may have any difficulty in walking or sometimes to control her bowel or bladder. Are you with me, Mrs. Smith?
yes, doctor, I am with you, but I don't know what can be done for my baby now.
Mm. Oh, yes, Mrs. Smith. I'll be discussing you as your baby is having a defect right now. So further, what we would like to do, I would like to arrange your appointment with a specialized team of doctor that we call as fetal maternal medicine unit. What they will do a detailed scan of your baby to see the defect, and then they will decide the further management plan for you depending on the ultrasound result. They may need take help from the baby doctor and the baby surgeon as well, but that all will depend on the uh, ultrasound report when it is done in the fetal maternal medicine unit. Am I clear, Mrs. Smith, so far?
Yes, doctor, you are clear. So you will refer me to another unit.
Yes, Mrs. Smith, for now I will be referring you, but still you have another option. Would it be okay if I discuss you some other options?
Okay, doctor, go on.
Yes, Mrs. Smith, either one of the option is that if the defect is found to be a large one, either one of the option is that you can continue with the pregnancy, but then you will be needing a lot of support and from your family and friends to take care of the baby because the baby may have a long-term handicap or may not be able to walk properly, or sometimes the baby may need surgery. Or the other option is that we can go ahead with the termination of the pregnancy as well. But it all depends, Mrs. Smith. upon your wishes.
Oh, terminate my baby Tom. How come? I am waiting Tom for a long time. I can't do this. Thank you. Time finish.
Okay, I'll just quickly wind up the session. So,
Okay, you
Mrs.
can
I'm
complete.
really very sorry. I'm really very sorry to tell you all of this. But for now, what I'll do, I'll arrange your appointment with the fetal-maternal medicine unit, and then depending on the result, further management will be discussed with you. Would it be okay, Mrs. Smith, if I arrange a appointment for you with one of the counselors and support groups, as talking to them may help you to deal with your emotions?
Okay, doctor, please.
All right. So, Mrs. Smith, this is the information. This is the written information about the baby's your Tom condition, what he is having. You can go through it, have you make up your mind, discuss with your partner. Whenever you feel comfortable, please come back to us. Or if at any time you
Okay,
feel that the baby is not moving well, or if there's any bleeding, your water bag breaks, then please come immediately to the hospital. Okay.
okay,
Thank
okay.
you.
Thank you, doctor. Thank you, Dr. Aisha. Very, very good. Excellent, Dr. Aisha. You did well in this task. Really, you cover all the point, and you managed to finish with the time, unless for some point time finish before you complete it, like agree management plan and the patient information leaflet and the contact number. But otherwise, you did very well in this task. Really, you cover all the point from the information gathering. Unless this patient, from the start, there is no information gathering requested from you. And as I said, if you enter to the station and you didn't found the information gathering, and this is in a simulated patient task, so you will expect drama in this station, like explaining result, breaking bad news. IUPD patient will explain the postmortem result,
Mm-hmm.
like this. So if there is no information gathering, try to be fast in taking the information that is relevant to the task. Don't go deep to the information gathering, because you may not benefit or you may not mark from the information in this task. So only
Yes.
take the relevant information, not to waste your time, and
Hmm.
leave the remaining time for the drama and for counseling the patient and reach to the agreement plan.
Yes.
You cover all, as I said. You breaking bad news very well, and you ask for someone else to come with the patient and give her a warning sign, first warning and second warning sign, and you show sympathy with the patient. And I feel this sympathy really. It will be also more appear and more mark if you are face to face to the patient, and your facial expression will show this to the examiner. You explained the spina bifida and ventriculomegaly very well, but I didn't hear you exactly. Did you draw or not? Didn't draw?
Yes, I did draw.
Yes. In breaking bad news, we prefer not to draw, as our mentor said, and as the RCOG course said that. In the breaking bad news, better don't to draw, because it may be offending to the patient to draw a defect in the back of her baby, or to draw a brain which is filled with fluid like this. So keep the drawing for any other case
Hmm.
except breaking bad
Hmm.
news.
Hmm.
Uh, After that, you go to the, when she asks you what can be done now for my baby, very good. You said now we can refer you to the fetal medicine unit. Very good. For ultrasound, detailed ultrasound scan. But you miss one point here, the amniocentesis, the needle test. We can
Hmm.
do also in the fetal medicine unit the needle test to check for the genetic makeup of your baby. Also, it will be a safety point and may be considered as applied knowledge.
Hmm.
Then after that, you mention the baby doctor and the surgeon doctor, and the outcome of her baby will depend on the, as you said, according to the location and the size and the type of the spina bifida. Your baby maybe can't walk alone, or your baby can have difficulty in controlling the bowel or the bladder, like this. You mentioned all of this. Regarding to the last option, the termination, very good. You explore this option well, and you take the opinion of the patient. At the end, you have to tell her we will support you regardless your decision. We will give you patient information leaflet to read and discuss this with your partner. It is your choice, and we will support you whatever you choose. And I will arrange another appointment with my consultant to have a friendly talk and to reach to agreement plan. Very good, Dr. Aisha. We can go to the model of answer.
Yes.
This is a breaking bad news. So please, in the breaking bad news, don't be funny and don't be mask face. Be reasonable. The smiling on the entering the cubicle, entering the cubicle, please don't make this a smile because it will not be reasonable and not match the situation with breaking bad news. You greet and introduce and confirm the identity as we used to do. Hello, I am Dr. Aisha, one of the senior doctors in the antenatal clinic. May I confirm your name and age, please? She said, Sarah. Hello, Sarah. I understand that you are here today because you are 21 weeks of your first pregnancy and you did a normal scan. Have you told anything about that scan? You have to explore whether she has any idea about this scan or no. She may say, yes, I know. Or she may say, as our case today, no, doctor, I'm here to know the result. Okay, anything serious, doctor? Sarah, in a moment we will discuss the result with you, but if you don't mind, I wanted to ask you some questions to know more about you. Is it okay? She may give you time, as I did today, to take a history from her, relevant history, and sometimes it will not give you any time, and she is excited and wanted to know the result now. She will not give you time to take a history. So if that happened and she wanted to know or insisted to know the result immediately, give her immediately. Breaking bad news immediately without taking history. In taking history, as I said, in the breaking bad news, usually he didn't ask you for the information gathering, so you will ask about the relevant history. Take the relevant history only, like, could you tell me more about this pregnancy? What is your blood group? Any medical problem? Any other allergies at all? You here fall in the trap of the cervical smear. This patient is 22 years old, so you shouldn't ask about cervical smear. Ask only when the patient is 25 or more. So this may less your mark in the applied knowledge. Then complete your history taking, either smoking, social, psychological, and the family history. Do you want to tell me anything? Thank you for sharing this information. Coming to the result of the scan, let me confirm your name and age, please. This will be considered a patient safety. You have to confirm the patient name and date of birth. This is the identity of the patient before explaining any result or before explaining the result of the scan. Then set the scene as you did. Sarah, I can see that you are here alone. Do you want me to call someone to be with you? Because I will give you a lot of information. She will say, no, doctor, you can go on. Sarah, I am so sorry, it isn't good news. This is the first warning. Sarah, I am so sorry, it isn't good news. Then give her the second warning. The sonographer has concern regarding your baby. Then silent. Sarah, the scan shows that your baby has defect in the back called Spina Bifida, and also increasing the amount of the water around the brain called ventriculomegaly. Have you ever heard about that? She will say no, and she will cry, and she will do a drama as she is prompted. Here you show sympathy, and the facial expression will be very important here. Sarah, I'm sorry to be a bearer of such news. Do you want me to leave you alone for some time? She will say no, sure. She will not tell you, yes, doctor, leave me for some time because we are in the exam. Can we continue, Sarah? You can, if she cries, start to cry, give her tissue. There will be a tissue in the table in front of you. Give her tissue. You can move the chair beside her for some distance. This all will be considered a good communication with the patient, and the examiner will be very impressed about that. Then explaining the defect and the ventriculomegaly without drawing. No drawing in the breaking bad news. Sarah, the baby has a defect in the back, and the effect of this defect will depend on the location and size and the type of the defect. Your baby may have a problem in walking or can't walk at all. Also, your baby may have a problem in controlling the bladder and bowel. Sarah, also the water around the brain is increased, and this will increase the pressure on your brain, on the brain of your baby, and your baby may have a mental problem. I'm so sorry to tell you that. Sarah, she will tell you what can be done now for my baby. If you don't mind, I can refer you to a specialist center called the Fetal Medicine Unit, where there will be a detailed scan by expert doctor to check for any other anomalies, and you may be offered a test called the needle test. You can explain the needle test in a few seconds. There will be a test introduced through your tummy under anesthesia and under ultrasound guidance, and this to collect a small amount of the water around the baby to test for genetic makeup. This is called amnosynthesis. Okay, because amnosynthesis will done after 15 weeks, and she is now 21 weeks. Okay, you will be offered another test called a needle test, where there will be a needle introduced through your tummy under ultrasound to collect a small amount of the water around your baby to be tested for the genetic makeup of your baby. You will be given a patient information leaflet for this test and consent to sign before this test, because there is a risk of miscarriage about 1 in 100. Am I clear? She will say, yes, doctor. Also, the baby doctor will come to talk with you about the outlook of your baby. Your baby may need surgery soon after delivery to close the defect. Also, the shunt of the fluid, he needs shunt of the fluid in the brain. Also, your baby may be offered a scan after the delivery to check the function of the kidney, how the kidney and the bladder stores the urine. Sarah, if you continue in this pregnancy, you have to complete the cycle as we said before. If the patient wanted to complete in her pregnancy, you have to mention the good thing first. Not go to the termination first. Keep the termination to be the last option. If you continue your pregnancy, you will have frequent visit and frequent checks, and you will be offered a growth scan after that. Sarah, it's very important to take folic acid 5 mg before any pregnancy after that, and this to prevent this to happen again. It's very important to mention this point. It will be a safety point. This patient should have or should take folic acid 5 mg 3 months before conception, after for any subsequent pregnancy, and to continue for the first 3 months of her pregnancy to prevent this to happen again, prevent the neurotube defect to happen. Regarding your delivery, it is early now to decide how and when you will have your baby, but we will aim for vaginal delivery in a consultant led unit, and you will be given a pain relief, and we monitor your baby heartbeats during the delivery. After the delivery, your baby needs surgery after the lift to close the defect and to shunt the fluid in the brain, and he may be offered the scan for the bladder and the kidney. Am I clear? She will say. At the end, you will explore the option of the termination. You have to complete. You shouldn't let the session or the cubicle before mention this option. Sarah, I am sorry to tell you that many women may find taking care of baby with such a condition is very difficult, so they may choose to terminate pregnancy. What is your view regarding this? See, in a few words, you can explore the option of termination in a polite manner, in a respectable manner. Sarah, I'm so sorry to tell you that many women may find take care of baby with such a condition very difficult. So they may choose to terminate the pregnancy. What is your view regarding this? What do you think? She said, okay, doctor, I want, or no, doctor, I don't want to have termination. How can I terminate my baby? Anyhow, if you wanted to end your pregnancy, you will be offered two types of the medicine or two types of the drug, 24-hour apart. The first one is mifepristone, second one is misoprostol. But if you are more than 22 weeks, your baby will be injected by a drug called feticide, not to feel any pain. Remember, in the abortion, if the baby is more than or equal to 22 weeks, sorry, from 22 weeks or more, before the abortion, you have to inject the baby with feticide, okay? But less than 22 weeks, we will not inject the feticide. Only give her mifepristone and misoprostol. But from 22 weeks or more, we have to inject feticide before abortion. And this not to feel any pain. Sarah, we will support you regardless your choice. You don't need to decide right now or to choose right now. Take your time and discuss this with your partner. And I will arrange an appointment with my consultant to have a friendly talk. Now, I will give you patient information leaflet to read about Spina Bifida, and I will give you a link of support group. Very important to this point. Very important at this point to mention. It will be also communication with the patient information leaflet, support group. I will give you patient information leaflet to read more about Spina Bifida, and support group where mother of such babies talk about their experience. Also, there will be a Shine. This is the website name, Shine website. Its name is Shine. Shine website, the charity which support the people with the Spina Bifida. Do you have any question? Thank you. This is the breaking bad news. Okay. Do you have any question? Any comment?
Dr. Ali, can I ask one question?
Yes, sure.
In this situation, it's already Spina Bifida has been diagnosed with ventriculomegaly. Is there any role for needle test?
Yes, needle test
should we mention?
Yes, we have to mention that to know whether there is any other genetic problem. This patient may wish to continue with this pregnancy if it's spina bifida only and ventriculomegaly only. But if we, by the genetic test or the amnosynthesis, we confirm that this baby is Patau syndrome, Edwards syndrome, like any other syndrome, she may change her mind. She may say, no, doctor, okay, now I need to have termination. My baby may have many congenital anomaly other than spina bifida and ventriculomegaly. So this is the rule of the spina bifida, the needle test to know whether any other genetic problem or no.
Okay, thank you.
Okay, welcome.
Hello, Dr. Ali.
Yes, Dr. Salma, welcome.
Yeah, thank you. I would like to ask one question.
Yes, please.
Yeah, after, we can explain that after delivery that we can do the scan because now antenatal period, this spina bifida, even though we do, there is no 100% guarantee. Even though it is normal, it could be abnormal after delivery also, and which is called spina equita. So we can explain like that. And if it is like that, then within 3 months we will repeat the scan to confirm it. And if it is more than 3 months, then we can do the MRI for confirmation. So do you think that we can explain like that?
You can if the time allow you, but take advice from me.
Mhm,
Please don't enter yourself in a problem or in a trap. Don't
mhm,
compound the thing for yourself.
mhm,
The time is very narrow. When you enter
mhm,
in the exam, you will know that the time will be very narrow for you to mention all the point. So
mhm.
we will try to catch the important point. Sure, no one will remember all the point 100%. You will forget. But when you forget small point, it will be better than you forget a large point, like exploring the option of termination, the fetal medicine unit, the baby doctor.
Yeah,
If you compound yourself, you will forget, and if you don't forget, the time will not allow you. So
yeah.
everything you can say, we can do another scan, we can do another MRI. This may be like that, but the problem here is the time.
It depends that patient if she's agreed to continue the pregnancy, then we can tell her that after delivery, uh, that even though now it is normal, but it could be that we can see after delivery also. Then we can confirm it. It depends on the
Yes,
history.
yes,
Yeah,
yes. If
yeah,
she wanted to continue her pregnancy, it will be reasonable here or relevant here.
yeah. Thank you very much.
Welcome to Salma. Okay. Any other
Hello,
question
Dr.
regarding
Ali.
breaking? Yes, Dr.
Hello.
Odi?
Yeah.
Okay.
Yes. Yes, Dr. Ali, is it can we take a history like whether she has taken any epileptic medication or whether she is having any diabetes or any risk of
Yes,
she herself having any spina
yes,
bifida? Should we take or should we skip
yes,
it off because
yes.
information gathering?
Very good, very good. You ask about that risk factor for spina bifida, whether she has diabetes in the medical history, whether she take any anti-epileptic drug, she has any epilepsy and taking anti-epileptic drug, any history of spina bifida before in her family. Also in the patient information leaflet of spina bifida in the NHS choices, they write if also the partner has a baby of spina bifida in his family.
Can we
Also,
ask
this will
that
put the
question?
patient at risk to have spina bifida. Yes.
Should we ask or
What?
not? We
Yes,
should
ask.
ask or
Yes, you
not?
have to ask. Yes, this is the relevant
Yes,
history. This is the one
yes,
I mentioned. And you have to
right.
ask about the relevant history.
Yes, thank you.
Welcome. Okay. We'll go to the second. Who want to share?
Shall I?
Okay, Dr. Udi.
Yes,
Okay, I will adjust for you 2 minutes.
yes.
Okay, start please 2 minutes. 2 minutes finish.
Hello. Yeah. Hello. I'm Dr. Adi, one of the doctors in the clinic
No,
today.
give me time to adjust the 10 minutes, please.
Yes, fine.
Okay.
Hello.
Okay. Start.
Yeah.
Yes. Hello.
Hello. I'm Dr. Adi, one of the doctors in the clinic today. How may I call you?
Call me Mary Jo.
May I confirm your age?
I am 28 years old.
Yeah, Mary, I understand that you have been referred by your midwife for your booking visit, and you are having a problem with your epilepsy. Is that so?
Yes.
Yeah. Is there any other concern and expectation from today's consultation?
No, doctor. Only I wanted to assure about my baby because I taking a drug to control my fit, and I wanted to know whether this drug will affect my baby, affect the growth. Can I stop this drug right now or no? Please.
Yes, I will address your concern, Mary. Before that, is that okay if I ask you a few more questions?
Okay, please, doctor.
Yes. Mary, can you please tell me about your pregnancy and also your condition?
Yes, this is my first pregnancy, and I am now, I think, in my 11th week, and everything is okay right now.
Is this the planned pregnancy, Mary?
Really, no, it wasn't planned, but it is welcome.
Congratulations.
Thank you.
And were you using any contraception before this?
We use condom, but condom may break sometime, and in the last time the condom break, so we get pregnant.
Yes, yes. Condoms are very effective against sexually transmitted infections, Mary. And Mary, are you visiting your specialist neurologist doctor previously?
Yes, I follow my specialist, and the last visit was since 6 weeks.
Did you discuss about your pregnancy plan?
Yes, he said to me it's okay because my last fit was since 2 years, and he said it's okay to get pregnant.
Okay. And do you have any vomitings in this pregnancy? And do you have any bleeding?
No, at all.
Okay. And when was your last period?
It was since 11 week.
Okay. And how about your blood group? Do you know your blood group?
Yes, it is all positive.
And do you have an idea about your BMI?
It is 24.
Okay. Are you up to date with your smears?
Yes, the last smear was up to date and normal.
Okay. And are you visiting GP for any other condition other than this?
No, it's only epilepsy.
Okay. And did you have any other operations
No,
on your tummy down below? Okay. And
no,
is there anything significant? Is there any significant family history to be shared with me?
no at all.
Okay. Are you well supported at home, Mary?
Yes, my partner is very supportive.
Whom do you live with, Mary?
With my partner.
Very good. And Mary, if you don't mind, do you smoke?
Occasionally,
Do you take alcohol?
no at all.
And do you take any recreational drugs?
No.
Yeah, so Mary, smoking sometimes may be not good for your health. I am not judgmental. If you want to stop smoking, I will put you in touch with NHS Stop Smoking Services. Is that okay?
Okay, doctor, please.
Yes. And Mary, did you feel ever down, depressed, and loss of interest in the surroundings for the past 4 weeks?
No, I am happy with my pregnancy.
Yes. And thank you for sharing all the information, Mary. Do you have anything else to share with me?
No, thank you.
Yes, Mary, coming to your concern, and the pregnancy most of the times with epilepsy will be straightforward, provided if you take medications in a proper way and if you are having a regular checkup. Am I clear?
Yes, you are clear.
Yes, and because you are already consulting your specialist neurologist, and he has given permission to take the medications for you, then the baby may not be harmed for till this time, because some of the medications are not baby friendly medications, which may need to be reviewed before you get your pregnancy. As you have already under the care of a neurologist, I hope that your medications are good for your baby also. Uh, and you better you continue that medication to in order to get good control of your seizures. Am I clear?
Yes, so it is safe to take this Keppra during my pregnancy.
You are taking carbamazepine. What medication you are taking?
No, I taking a medication called Keppra, levetiracetam.
Yes, because yes, the levetiracetam is having a less side effects, and it is the literature shows that it is a safe drug during the pregnancy, and also your neurologist is also telling permission to take the medication, that it is a baby friendly medication. You can continue that, and your care will be under the multidisciplinary team of the doctors like neurologist and as well as obstetrician, specialist nurse, specialist midwife, and as well as a specialist physician, because the epilepsy as such may not may not have much effects on your baby unless there are baby friendly medications, because some of the medications which are not advisable during the pregnancy, which can cause harm to your baby, like they may cause the effects on your baby's backbone, as well as some of the anomalies with the cleft and all those things. But some medications are good. But for your case, this medication is good. But sometimes there may be a problem with the growth of the baby, as well as with the uh, you and sometimes you may have some preterm labors because of the restricted growth. So you will your care will be under the multidisciplinary team of doctors, and you may have special scans during your pregnancy to check whether the baby is growing normally. And most of the epilepsy will be under control during the pregnancy, because the pregnancy as such will not have much effect on the disease. Sometimes because under control, because of the immunological, the immune system will be changing in the pregnancy. So most of the times it will be under control, unless you have a recent history of fits. But your last, can I know when was your last fit episode, Mary?
Yes, it was since 2 years.
Yes, because most of the times, if you are having a last 52 years, it is unlikely that you will get into the fits during this time. But there are certain risks associated with if you don't take the medications regularly, because that may exacerbate the fits. And sometimes, I'm so sorry to say, sometimes there may have a sudden death if you get excessive continuous fits during your antenatal period. That is the reason why we always advise the woman to take regular medications, and also we'll advise not to become overstressed, like loss of sleep and loss of some dehydrations, not avoid dehydrations during the pregnancy to prevent these seizures. And your delivery will be straightforward and normal vaginal delivery. There is as such no indication that during the epilepsy is not an indication for cesarean section. And during the delivery, you can take your medication, and also you will be advised not to be dehydrated, and you can deliver normal vaginal delivery, provided everything is normal, your baby is growing well. And after the delivery, your postnatal care will be taken guarded, because there is a high chance that you, because of your breastfeeding, because you can go through the breastfeeding with the baby friendly medications, like levetiracetam is good to go for the breastfeeding. And but only thing is you will be given advice to take to nurse the baby on the floor and not to give bath onto the in the shallow waters only. And because whenever you need to take care of with the support from the family, and as well as from the if you don't have, you can, I will put you in touch with the social groups also who can help you a lot in this condition to take care of your baby as well as during the feeding. And I will give you the information leaflet.
Okay, let's
I
continue.
will. And thank you for sharing all the information.
Thank you. If you want to continue, you can continue. Okay, no problem.
Yes, I'm done because I need to. I will give you a patient information leaflet. You can go through that, and I will write back to your GP the same thing so that you can be followed every time in the consultant let unit.
Okay. Thank you.
Thank you.
Very good, Dr. Odi. You did well in this session. Really, you mentioned and you cover all the scenario. I know that it's too long a scenario. And it has a lot of information you have to mention. But we will comment only in a small point. Regarding to a communication with the patient, your communication with the patient wasn't so good. You didn't ask me or seeking understanding or invite me to ask any question too much. You give me a lot of information, horrible information, and sometimes I didn't concentrate with you because you give me a lot of information. So you have to give it in a pause and stop, check for understanding, and continue again. This will come with practice. And your flow of speech was so fast. Also, I know it is a long scenario and we have only 10 minutes, but it is a communication and the consultation with the patient, not only to mention the information and the patient didn't get any point or didn't understand any point. So only also try to slow down your flow of speech. Otherwise, you did well. The organization of your history taking and in counseling also need some modification. You go to obstetric history. After that, you go again to the history of the present illness. In the end, you ask me about the last time of my fit. It's supposed to be from the start to check your condition. It is the history of the present illness. But otherwise, you cover all the point. Even you go to the postpartum and what you will do in the postpartum and how it will be her delivery. So excellent in doing this. And regarding the communication, it will be inshallah improved with practice. Coming to the model of answer, as we used it, we have a template to go through. Not to forget anything and not to invent any information or any word in the exam, because the time of the exam is very narrow and you will be in difficult stress. So you have to make your own template to go through. First, greet and introduce as you did. Hello, I am Dr. Ali, one of the senior doctor in the antenatal clinic. May I confirm your name and age, please? She said, okay, I am Mary. Hello, Mary. I understand that you are here today to book your pregnancy. Am I right? Simple word. Simple word. Yes, I also understand that you have epilepsy. Am I right? She will say yes. Here we can appreciate any patient with medical problem care to book her pregnancy early, or any patient with medical problem came for preconception counseling. You may appreciate her. If you appreciate her, it will be a good point in communication. Appreciate that she came early to ask for consultation. She came early to do preconception counseling before she get pregnant. and she know that she has medical problem, or she is on medication, so she asked for a medical consultation before continuing the pregnancy. So here it will be reasonable if you appreciate this patient. Mary, it's very good to seek medical advice once you become pregnant. It shows how careful you are about your baby. Simple word, it will be give the examiner a good idea about you, that you appreciate this patient. You will take the patient to your side, make communication with the patient. Then, as you did put agenda, before you discuss the best management plan for you, I want to ask you some question to know more about you. Is it okay? She will say okay. Then go systematic. History of present illness. It should be the first. Should be the first item to ask. History of present illness. Here, our present illness is the epilepsy, the seizure. So you have to ask. Could you tell me more about this epilepsy? She may tell you everything about her epilepsy, about last consultation, about the medication, about the last fits, anything, everything. This will be an open question. Could you tell me more about? This will be open question, and in the examination, they like very much the open question rather than the closed one. If she didn't mention any point, so you have to ask her in a closed one. Okay, so when was last consultation? She will say, oh, 6 weeks. Any medication do you use? You have to ask about the medication. What she take to control her seizure? How you control your seizure? She will say, yes, I take Kebra. Kebra is levetiracetam, 500 milligram twice daily. Okay, and how will control with this medication? She will say, everything is okay. Okay, so when was the last one? The last fit? It was since 2 years. How do you feel right now? I'm okay, doctor. Okay, then you will go to the obstetric history. So all the medical problem, we have to ask about the history of the present illness by this question. Start by open question. Could you tell me more about this diabetes? Could you tell me more about this sickle cell disease? Could you tell me more about anything, thalassemia, anything? When was last consultation? Any medication? How well controlled? When was the last visit? When was the last fits? Any hospital admission? You can ask. How do you feel right now? All of these to ask about the history of the present illness. Then go systematic, as we used to do. Obstetric history. Okay, is it planned pregnancy? She said no. I prompted to say it is welcome. Okay, so you said congratulations. Very good. Very good. You congratulate me on when I said it is welcome, the pregnancy. If I didn't say that, I said only no. So you have to ask the next question. Are you willing to continue on this pregnancy? Are you happy to continue on this pregnancy? She may say, no, doctor, I wanted to terminate it because this is unplanned pregnancy. She may need to terminate. Okay, so from the first start or from the first moment, you will change the consultation. It will be asking for abortion. Okay, if she said, no, I want to terminate my pregnancy. Okay, we will go for another side or another way. But she said, yes, doctor, are you willing to continue? She said, yes, doctor, it is welcome. Okay, so congratulations. And any scan or test you did in this pregnancy, she will say, no, it is my first visit. Okay, go to the gynecological history. Could you tell me about your last menstrual period? She said 11 weeks. This is to confirm the gestational age. Here, the cervical smear is relevant because she is 28 years old, and you mentioned, yes. And the contraception, any unplanned pregnancy, you have to explore the contraception. Ask her about whether she used any contraception or no. How do you protect yourself from unplanned pregnancy? She will say, I use condom, but doctor, condom sometimes broken, and at that time my partner condom broken and the pregnancy happened. Okay, here you have to stress on this point. Stress on this point. It will be a patient safety. This point will be patient safety. So, Mary, condom is a good option for contraception, and also prevent sexual transmitted infection. I know you mentioned this point. Very good. But you know you may forget, or even it can broken. So it's very important to use reliable method of contraception, not to have any unplanned pregnancy again. Is it okay? Okay, so any unplanned pregnancy, you have to stress on the point of contraception. She use any contraception or no? She may use contraception but forget, okay, but she may not use any contraception at all. She may use condom. So condom is a good option, and also prevent sexual transmitted infection. You have to mention in the start is the good point in the condom, but what is the bad point? It sometimes you may forget, the partner may forget to have the condom or can broken. So it's very important to use a reliable method of contraception to prevent any unplanned pregnancy again. Then go through the remaining template, medical history, surgical history. Here in the drug history, very important. You can ask about the Kibra in detail, how much the dose, how many times you take it. If she didn't mention folic acid, you didn't mention folic acid. She is patient with epilepsy taking anti-epileptic drug, so you have to ask this folic acid. Will be patient safety. Folic acid here, it's very important. So did you use folic acid? She will say yes. How much the dose? You have to ask here about the dose. Okay, here in the patient with diabetes, the patient with epilepsy taking anti-epileptic drug, the patient with previous spina bifida, you have to ask about even the sickle cell disease patient, the thalassemia patient, you have to ask about the dose, because if the patient take only or 400 microgram, she need to convert it to 5 milligram. And this 5 milligram can't be taken from the over counter or in the supermarket. She has this dose has to be written by a doctor. The obstetrician or the GP can only write this dose. However, the 400 microgram, the patient can buy it from the supermarket or from the over counter in the pharmacy. Ask about the allergy, smoking and alcohol. Social history, ask about the support at home and what she do for living. Psychological history, you explore the psychological history, very important, because the patient with epilepsy is at a risk to have depression, as you read in the guideline. So you explore this. And already we explore all the psychological problem and the psychological history in the all antenatal patient. Family history also may be important here, because sometimes it will be genetic relevant of the epilepsy. This time we can do genetic counseling. You wanted to add anything? Thank you for sharing this information. Now you cover all the information gathering, all the history taking. So you will go to examine the patient as we used to do, examine the presence of chaperone after taking consent of the patient. Here it will be only the pulse, blood pressure, temperature. Nothing it will be done in early pregnancy. Then you will take the patient take the patient to a course during her pregnancy. We'll talk with the patient about the effect of the disease on the pregnancy and the effect of the pregnancy on the disease. We have to fix this in all maternal medicine module. When the patient came with hypertension, we will talk about the effect of the pregnancy on the hypertension and the effect of the hypertension on pregnancy. When the patient came with diabetes, we will talk about the effect of diabetes on pregnancy and the effect of the pregnancy on diabetes. Like this. Mary, most of the pregnant women with epilepsy, about 2 in 3, will have a healthy pregnancy and a healthy baby. However, some women may have a congenital anomaly of their baby due to the use of the anti-epileptic drug. And they will reduce that by using a baby-friendly drug. And already that levetiracetam, that the one that you use, is one of the preferred drug in the pregnancy here. So now you cover the concern of the patient. The patient has concern about her medication. You cover here the concern here that the levetiracetam or Takebra is one of the most preferred drug. Also, in the epileptic patient, the baby may grow smaller than expected, and they will check for that by the gross scan from 28 weeks. The woman may be at increased risk of seizure, and especially those which stopped their medication or not taking it regularly. and also due to the stress of the pregnancy and tiredness. So what will be her management? As we said, cycle. It will be antenatal, delivery, and postpartum. Your care will be under a group of doctor, multidisciplinary team. In the all maternal medicine, we have multidisciplinary team. They like this very much, multidisciplinary team. In the simulated patient task, you will not say multidisciplinary team. She will not understand you. You will say under group of doctor, which include you have to mention who will be in her multidisciplinary team: obstetrician, epilepsy specialist, and specialized nurse. You will have frequent visit and frequent checks, during which you will be offered a routine test. What is the routine test offered for any patient in early pregnancy? You know, from the antenatal care guideline, nice guideline. A blood group, RH, anti-RBCs antibody, complete blood count, antibody against certain virus like HIV, hepatitis B, syphilis, rubella, and urine infection. You will have a screen for Down syndrome by the combined test because you are now 11 weeks and it will be done between 11 and 15 weeks. Okay, and screen for neural tube defect in the back of your baby, and this will be by the scan and the serum test called alpha fetoprotein. You will be offered dating scan to know the age of the baby and when you will have your baby, annual scan at 18 to 21 weeks. A lot of information you have to mention because this will be applied clinical knowledge, and every one of this it will be by a mark. So you have to mention all of this. Gross scan from 28 weeks. Very important this point. You should continue your medication without any change unless by advice from your specialist. You should have much rest and sleep as you can. Continue on folic acid 5 milligrams through your pregnancy. Avoid any dehydration, and if you vomit, you should seek medical advice. Delivery, as we used to say, make it a template. It is very early now to decide how and when you will have your baby, but we will aim for vaginal delivery unless there is an indication for cesarean section. It will be in a consultative unit. This patient should deliver in a consultative unit. She can't deliver in home or maternity or midwife maternity unit. Consultant unit, you will be offered the pain relief option except Bethadine. You have to mention that. Definitely, you will lose your one mark if you didn't mention Bethadine in the patient of sickle cell disease and the patient of epilepsy. You will lose one mark or the mark for here the patient safety. If you did, it will be considered patient safety. So patient safety is very important. Patient safety very important. So in every task you have to know what is the safety point in this patient. You may fail in information gathering, but patient safety may pass you. So you have to mention the negative. You can say, okay, doctor, I can say I will give you pain relief option and stop here. No, you have to mention the negatives. You have to mention the negative. If the Bethadine is contraindicated for this patient, you have to mention that we will not give you Bethadine because, and you have to justify yourself. Why you will not give me Bethadine? Because it increases risk of seizure. Also, in the sickle cell disease, you will not give her Bethadine. You have to mention the negatives. We will monitor the heartbeat of your baby. In the guideline, the green top guideline say that it can be intermittent auscultation, no need for CTG. Will continue your medication during your delivery and will minimize the stress and the anxiety. After delivery, there will be a baby doctor and you breastfeed your baby and it will be safe with this medication. But it's very important to feed your baby on the floor. There will be safety point. And if you feel any warning sign, put your baby down. Very important to mention this point. It will be patient safety. Pass yourself and your baby in a shallow water and better with assistant. After that, we will give you an appointment for contraception and continue your drug. If your drug is increased during a pregnancy, it will be reviewed in 10 days to avoid toxicity. Then at the end, you will ask her any questions so far. I will give you now patient information leaflet about epilepsy in pregnancy and the contact number. You mentioned, I will write back to your GP from our colleague working there in the UK. They said that they didn't write back to the GP in the pregnancy. So you don't have to mention this point, writing back to the GP. You can write to the midwife, write back to the midwife. If the midwife refer the patient for example, for suspected small for gestational age or large for gestational age or abnormal test, anything, you can write back to the midwife. But the GP, you didn't write back to the GP in the antenatal care.
Okay, thank you. Thank you, Dr. Ali.
Welcome.
Dr. Ali,
Yes, Dr. Ansar.
can I ask a question, please?
Yes.
What Kipra? I'm sorry, sir. This is lamotrigine.
Lamotrigine?
Yes.
I think it is levetiracetam. I think.
Yes, sir. But I'm
not
sorry.
sure. But
No,
you
it is levetiracetam. Dr. Ali, it is levetiracetam.
Yeah.
Levetiracetam. Yes. I checked. It is levetiracetam.
It is. Yeah, it is lamotrigine. Yes.
No, not lamotrigine. Levetiracetam.
This is one of the safe drugs during epilepsy for epileptic patients during pregnancy. I mean, there is preferred drugs as I studied before, such as lamotrigine, one of the safest drugs during pregnancy with epilepsy. I'm sorry, I didn't hear about Kipra.
Yes, Dr. Ansar, I totally understand you. I know that lamotrigine is very safe, and it is now it is that trend in using controlling the seizure during pregnancy. But levetiracetam also is safe, and we have patient taking levetiracetam during the pregnancy. Kipra is levetiracetam, and as I said, we have still patient. Continue on the levetiracetam during pregnancy, and it's one of the safest drug also. Besides
it is safe during breastfeeding.
Yes, I didn't hear any side effect or any warning about levetiracetam in the pregnancy or in the breastfeeding from the Green Top Guideline of Epilepsy and the epilepsy pregnancy.
Hello?
Yes.
You're hearing me, sir, I think.
Yes, I am hearing you, Dr. Ansar. Yes, levetiracetam, I didn't read any article or any warning sign or side effect during breastfeeding or pregnancy in the Green Top Guideline and the TOG of epilepsy.
Okay, sir. Is this levetiracetam? When I ask her to for a reliable contraception, should I mention anything about oral contraceptive pills, because the estrogen will affect the drug? This is affected by the drug, or the drug that affects the COC?
Yes, if she's taking lamotrigine, I know lamotrigine is already the concentration of lamotrigine will be decreased in pregnancy. And by combined oral contraception, any estrogen will decrease the concentration of the lamotrigine in the body. So it will put her at a risk. Yes,
sir.
It will put her at a risk.
I mean about yes, levetiracetam. So I ask.
No. Also,
and yeah.
No, levetiracetam will not be affected by pregnancy or by combined hormonal contraception.
And will not affect the level of estrogen in oral. Will not affect it. It will not decrease the level of estrogen.
No, even the guidelines, the Green Top Guideline, didn't mention that at all. The Green Top Guideline mentions that the concentration of lamotrigine, it will be the one who decreased, not the estrogen, not the estrogen in the hormonal contraception.
Yes, sir. Yes, and you know there is other drugs which affect the level of the COC, so it could decrease its level and the patient got pregnant on top.
Yes,
the enzyme inducers.
Yes,
Yeah.
enzyme inducer, levetiracetam is not enzyme inducer. We have enzyme inducers, the phenytoin, the phenobarbital, the carbamazine.
Yes, sir.
All of these are enzyme inducer, but this one is not enzyme inducer. So can you
Thank you.
tell me? So can you tell me if the patient use enzyme inducer, what will be the suitable contraception for her?
I think IUD
IUCD
and Depo-Provera.
3 eyes.
and good and
Marina.
Depo-Provera is right, sir.
yes, Depo-Provera is
all
right.
And Marina.
All
And
prostagen.
Marina, good, Dr. Salma.
Medicated IUD, yeah. IUD and medicated
Yes.
IUD, yes.
Denpa, Marina,
Yes,
and Pop.
we have three options for the patient taking enzyme inducer. It will be the copper IUCD or levonorgestrel releasing intrauterine system, the Marina,
Yeah.
and
Yes.
the Depo-Provera. Okay, excellent. Another question.
Excuse me, Dr. Ali.
Yes, Dr. Salma.
Yeah. There is one thing you have written that growth scan from 28 weeks. Do you think 28 weeks or 24 weeks growth scan?
The growth scan.
Yeah.
I know that the growth scan will start from 24, but I think in this guideline exactly, he mentioned it will be done from 28, because when I prepare my PowerPoint, I usually open the guideline. So you can check me. I may be confused. You can check and you can correct me in the group.
Right. Okay. Thank you. Another things you told to the to ask the patient for understanding. So what you recommend that how many times we will check the understanding and where that is it in the
Yeah.
management option or after the explaining the her investigation, and which place that if you recommend us then we can follow nicely this one. Thank you.
Thank you.
Hello?
It will be for Dr. Salma. Can I
Yes.
respond for Dr. Salma? It will be
Yes.
for you. You can manage by yourself. It will be individualized. If you feel that the patient is not with you, you give the patient a lot of information, you have to pause, stop, because checking understanding and the communication of with the patient is very important, more than giving her information and the patient not with you and the patient didn't get that. So
Yes, of
give
course.
her in short pauses and stop. Are you with me? Are you following me? Is it clear? And you have to change the formula of asking understanding at every time. Yeah, not the same question. Not every time. Are you following me? Are you following me? Are you following? No, change. Is it clear? Are you following me? Is it okay? Like this. Okay. Thank you, Dr. Salma.
Dr. Ali, I'm sorry. Another thing,
Yes.
sir. If you
Yes.
ask me about what are the warning signs that you tell me, so I could put the baby.
Yes,
I mean,
she will know more than us. That if she
Yes,
feels that
yeah.
she has a headache, if she feels that she has a tremors in her hands, blurred vision, like this. You can mention all of this. If you have an aura, you can mention all of this. You have to put your baby on the floor and ask for assistance.
Hello, Dr. Ali.
Thank you.
Okay, welcome, Dr. Asina.
Yeah, just I want to ask, I think implant is not used with the enzyme inducer because it contains progesterone also.
Which one?
Implant?
No, implant not used with the enzyme inducer.
Yeah.
We have only three options for enzyme inducer. Copper IUCD, intrauterine system, Mirena, and Depo-Provera.
Yeah, sure. Thank you. And other thing regarding safe drug, in case, for example, using lamotrigine or this Capra, it is a safe. We cannot say it should not say 100% safe or like that. Just to tell her, for example, there is no evidence that, or there is evidence that safe, but we cannot say 100% like that.
Yes, if you are not sure and you are not sure from the drug, don't mention that it will be safe 100%. As we said here in our PowerPoint, we can get it. I said it's one of the preferred drug. I didn't say it's safe or is it not safe. So I catch the from the middle. So it's one of the preferred drug. I didn't say it will be safe 100% or not safe 100%. Okay.
Yeah. Okay. Clear. Thank you.
Welcome. Here, I already levetiracetam, one of the most preferred drug in the pregnancy. Okay. Okay, guys, can we take 10 minutes to pray? I will pray Maghrib. 10-minute rest, please. Okay.
Okay, yes, Dr. Thank you.
Yes, sir. Yes, sir. Of course. Yes. Thank you.
Okay. Thank you. Thank you very much.
This conference will now be recorded.
Assalamu alaikum.
Wa alaikum assalam.
Okay. This is case number 8. It will be the same as case number 7, but in this scenario or in this task, this patient came in the pre-conception counseling. This patient with epilepsy, and she came today for pre-conception counseling. This will be a simulated patient task, assessing information gathering and communication with the patient safety, applied clinical knowledge. You are about to see Miss Lucy Brown, who is 21 years old, a known case of epilepsy, and she came today as she is just married and she is planning to have baby. So now she came in the pre-conception clinic because she is planning to have a baby and she is epileptic patient. She is on dual therapy of sodium valproate and carbamazine. Her last seizure was since 3 months, and her last consultation was since 1.5 years. So this patient do not follow her specialist. Her last visit since 18 months, 1.5 years. You have 10 minutes during which you are expected to take relevant history and address the patient concern and put management plan. In this scenario, you will go as the previous scenario, in greeting and introducing yourself, checking the purpose of the meeting, appreciate, as we mentioned before, if the patient with maternal problem and she wanted to take preconception counseling or to book her pregnancy early, you have to appreciate this patient because she came to ask about the consultation. Then put agenda and take history in a systematic way, as we mentioned before. Here in the preconception counseling, it will be different from antenatal module by adding your opinion for this patient. This patient, you have to tell her what is your opinion regarding her plan to get pregnant. From the history, as we said, she is epileptic patient and she is on dual therapy, sodium valproate, one of the most teratogenic drug, carbimazine, and her last seizure since 3 months, and her last consultation since 1.5 years. So it seems that this patient are taking teratogenic drug, and she is not controlled well because she has last seizure since 3 months. So after taking the history of the patient, you have to tell her your opinion like this: Lucy, from your history, I strongly advise you to continue on this unreliable method of contraception. And here we can mention the contraception. This patient on carbimazine, it is one of the enzyme inducer, so it will be suitable for her only to take, as we mentioned, the copper iod or the Mirena or dibomethoxyprogesterone acetate, diboprofen. Why? Because I wanted to arrange a consultation with your specialist epilepsy doctor to see how is your disease controlled and how to review your medication and whether we can change this medication to baby friendly drug, as using more than one drug and also using the sodium valproate will increase the risk of your baby to have congenital anomalies like neural tube defect and facial clefts. So this is your opinion. After taking the history from the patient, it will be patient safety to give the patient your opinion. This patient not now safe for her the pregnancy. The pregnancy will not be safe for her. So from the patient safety to say that it is, I strongly advise you to continue on reliable method of contraception. This will be the copper iod or the Mirena and or the dibomethoxyprogesterone acetate, and this is because I wanted to arrange appointment with your specialist doctor to see how your disease is controlled and review your medication, and to see whether we can change these drugs to baby friendly drug as using more than one drug, and especially the sodium valproate will increase your baby the risk of your baby to have congenital defect like neural tube defect and facial cleft. Also, the longer the duration since you have your last seizure, the least likely you will have fit in this pregnancy. Her last fit was since 3 months, so it is a short duration. And as the guideline mentioned, the longer the duration since she has her last seizure, the least likely she will have fit in this pregnancy. Also, this patient, when you take history, she didn't take folic, so she should take folic acid 5 milligram at least 3 months before conception and to continue through the pregnancy, and this to decrease her risk to have neural tube defect. So you have to mention this 3 points after taking the history of the patient. After that, you will continue as usual. You will take her through a course of her pregnancy. You will talk about the effect of the pregnancy on her disease and the effect of the disease in her pregnancy, as we mentioned in the previous scenario. And you will complete your cycle by antenatal, what will be done for her in her antenatal care, how will be her delivery, the same as the previous scenario, and how will be her postpartum care. So the different point here in the preconception clinic, you will give this patient not pregnant right now, so you will give her your opinion about planning of pregnancy, whether it's safe for her now to go for pregnancy, or she has to continue on the contraception till her condition become controlled and till she see her specialist doctor to change this teratogenic drugs and to take the folic acid 5 milligrams at least 3 months before conception. Any question in this one?
Excuse me, Dr. Ali.
Yes, Dr. Salma.
Yeah. Yes. During delivery, okay, if patient had this seizure, so
CTG.
no, if patient had seizure during
Yeah.
delivery, so do you think that first initial action is to inform the neurologist, or I can give the clobazam if she has previous history of seizure last pregnancy? I'm just asking as to know only if there is a structured discussion they will ask, just to know only. Do you have any idea?
Yes. When you admit this patient in your ward, this patient will be under care from the first moment. This patient will be under care of you, under care of the neurologist. So there will be plan written for her how this patient can be managed if she develops seizure. It will be according to the protocol of each hospital. According to the guideline, as you mentioned, the first choice it will be the benzodiazepine. I think it will be the clobazam. I think
Clobazam. Yeah.
clobazam. Yes. And the second line will be, I think, diazepam. And the third line, it will not controlled. It will be the phenytoin. So it will be according to the hospital protocol, and this will be clearly written in the patient note. If the patient has fit, it will be given clobazam or diazepam 10 milligram intravenous slowly, or phenytoin 1 gram over 5 minutes or 10 minutes. So you will give her first is a drug because it will be life saving, because this patient during the fit may have she may arrest, or she may have a hypoxia, she may have a brain insult. So you will give her and to arrest the fit, and after that you will call for help. Call for help for your senior obstetrician and the neurologist and the senior midwife.
Yeah. What I can remember, this question came our part 2 exam also. You know that some may answer that neurologist,
Yes.
initial step will be neurologist, or some may answer that clobazam we can give. So for my impression that if there is a history of that seizure, then we can give this clobazam. By this time we can refer to we can inform the neurologist.
Yes, you have to stabilize the patient first and call for help after that.
Yeah. Thank you very much. Thank you.
Okay, welcome. Yes. Okay. Who wanted to share the next one?
Hello, I want to present.
Doctora Saima.
Yes, sir.
Okay. Doctora Saima. Okay, take this one, Dr. Saima.
Okay.
I will arrange 2 minutes for you to read the instruction. Okay, start 2 minutes. Okay, can I start now? I will adjust it 10 minutes for you.
Okay. Hello, I'm Dr. Simon. I'm one of the senior doctors in the clinic today. I confirm your name with you.
My name is Mary John and I am 26 years old. Can you raise your voice, please?
Okay. Is it clear?
Yes, if you can do better than this, it will be okay.
Okay. Hello, I'm one of the senior doctors in the clinic today. May I confirm your name, please?
Yes, my name is Mary John and I am 26 years old.
Can I call you Mary?
Yes,
Mary, nice to meet you.
excuse me.
Mary, nice to meet you.
Nice to meet you, doctor.
Okay. Mary, what I gathered from your notes that you want to conceive. Am I right?
Yes,
Okay. And I also gathered from your notes that you have a condition called Marfan Syndrome. Am I
yes,
right?
doctor. Yes.
Okay. Surely within the next 2 minutes, I am going to discuss your management. But before that, I will ask you certain questions. Is it okay?
Okay, doctor. Okay.
Okay. Mary, can you tell me more about your condition about Marfan Syndrome?
Yes, doctor. I was diagnosed with this when I was 10 years old, when I have a problem in my vision. And I went to the eye doctor. He said that there is a problem in my lens, and he referred me to a heart doctor. He did scan for my heart. Also, he said some problem in my heart, and after that, I did a genetic test, and they confirmed that I have this syndrome, Marfan syndrome.
Okay. And are you calling your doctor regularly?
Yes, I have to go there.
Okay. And when was your last visit?
It was since 2 years.
Okay. Can you please tell me why are you not calling your doctor regularly? Because you have your last visit 2 years back.
Again, what?
Uh, I
Excuse
just want
me.
to know why. Hello. I just want to
Hello.
know your last visit was 2 years back, and why are you not calling your doctor regularly?
Yes, I used to go to my doctor, my specialist doctor, but my last visit was since 2 years.
Okay. And are you taking any medications right now?
Yes, I took two type of tablet. The first one called Ramipril, and the second one it called Endural. It is beta blocker to control my heartbeats.
Okay. And have you undergone any investigations for your disease?
No, no.
And do you have any cardiac issues?
R again?
Any heart problems?
No, no, no.
Okay. And do you have any other medical illnesses instead of it?
No, I don't have any other medical problem, doctor.
Okay. Have you undergone any surgery?
No, at all.
Okay. And are you allergic to any medication?
No.
Okay. And Mary, can you please tell me what do you do for a living?
Again, sorry.
What do you do for a living?
What to do for the, yes, I am housewife
Okay. And whom do you live with?
with my partner.
Okay. And how's everything at home?
Yes, he is supportive.
Okay. And have you ever been pregnant before?
No, no at all. I hope I can come. I can be pregnant, doctor.
Okay. And are you taking any contraception right now?
Only condom.
Okay. Okay, Mary, I want to tell you that you have a condition called Marfan Syndrome, and currently you are on some medications called Renitril and Indol, and you are using condom for contraception. And do you want to add something else?
Again, sorry.
Do you want to add something else?
No, no at all.
Okay. Uh, okay, Mary, the medications you are taking, we want to review your medications because some of these medications are not good for your baby. And for this, I will refer you to your doctor who is taking your condition. And they will review your medication and they will change your medication to safe and effective medication. And you will also be given, you will be started on folic acid 5 milligram dose so that you don't have any problems during pregnancy like neurotic defects and your pregnancy will be cured in a till that you will use some effective contraception because condom are a very good choice of contraception and they are also they also prevent against sexually transmitted infections, but sometimes they might hurt and you might get pregnant. So till your condition is stable, I don't allow you to get pregnant. I will refer you to your doctor who is a specialist doctor who is dealing with your condition. They will review your condition and they will review your medications. They will change these medications effective to some other medications which will be baby friendly and they will assess your heart that either your heart is functioning normally because in patients with Marfan syndrome sometimes the vessel which is pumping the blood out of the heart which we call aorta get enlarged so that if you get pregnant with this enlarged blood vessel with dilated blood vessels you will be at the risk of rupture of this blood vessel during the pregnancy and this blood vessel might get more dilated during pregnancy and your life even can be at risk. So we want you to enter into pregnancy in a healthy state. So it is very much important for you to be in a healthy condition before you get pregnant. And after you get pregnant, your pregnancy will be cared in a consultant-led unit, and a joint team of doctors will uh, uh, deal with your condition. Are you following me, Mary?
Yes, I'm following you, doctor. Yes.
Okay. And because this condition is a genetic condition, your baby might be at the risk of developing the similar condition. Can I know if your partner okay or did he have some other
Yes, my
condition?
partner is okay. He didn't have Marfan syndrome. He did test and he didn't have Marfan syndrome.
Okay. And I will also refer you to the genetic counselor, so you should be aware of the risk of developing risk of your baby developing the similar condition because it is because Marfan syndrome has a risk of 1 in 2 babies might develop the similar condition. So during pregnancy, uh, we might need to do a needle test of your baby to know either the baby has similar condition or not. And if your baby is healthy, we will follow your pregnancy and you will have a serial ultrasound of heart which we call echocardiogram during the pregnancy to know that you are stable. And if you feel anytime any chest pain or shortness of breath, you should immediately contact your doctor. And you will be the delivery our aim will be to deliver you normal until there are some obstetric complications. So
Time finish. Okay, you can go on. Complete.
I am providing you some reading material about this condition, and you can read it and decide upon. And I'm referring you to the to your specialist doctor, and I will arrange another meeting with the consultant, and I'm writing a letter to the PT about your condition. Am I clear?
Yes, doctor. Thank you.
Do you have any questions?
No, doctor. Thank you.
Okay, thanks.
Thank you, Dr. Saima. Excellent in doing this task. You did very well, except only your voice was very hard to be heard. I hardly hear your voice. I put my ear in front of my laptop to try to hear you. So you did well in this task. This is a case of Marfan syndrome. She came for pre-conception counseling. Please, can you mute yourself, please?
Okay.
Everyone mute himself. Yes, thank you. This is a case of Marfan syndrome came for pre-conception counseling, and as we have to do, or we used to do, you will greet the patient and introduce yourself and checking the purpose of the meeting, putting the agenda, and appreciate the patient, appreciate that she came for pre-conception counseling because she has a medical problem. After that, you will go to take history. Really, you mentioned all point in this Marfan syndrome. You mentioned the heart doctor. I think you mentioned the eye doctor, and she has to be referred she has to be referred to her specialist to offer ultrasound scan to check the function of the heart, and you take her through the course of the pregnancy of a patient with Marfan syndrome, talk about the effect of the Marfan on the pregnancy and the effect of the pregnancy on Marfan syndrome. So we can go through the model answer. Greet and introduce yourself as we used to do. Hello, I'm Dr. Saima, one of the senior doctors in the clinic today. May I confirm your name and age, please? Hello, Mary. I understand that you are here today because you are planning to have a baby. Am I right? She said, yes. I also understand if you know that you have Marfan syndrome. Am I right? Yes. It's very good that you seek medical advice. As we said, appreciate that she come to seek medical advice before embarking in pregnancy. It's very good that you seek medical advice once you think to have a baby. It shows how dedicated you are toward your coming baby, how careful you are toward the coming baby. Before we started your pregnancy, I wanted to be sure that you are in the best possible shape, and this is to have a healthy pregnancy and a healthy baby, and to decrease the complication in pregnancy. So I wanted to ask you some questions to know more about you. Is it okay? This will be the agenda. Then, as you did analysis of the complaint or analysis of the history of the present illness, you ask for the first open question. Very good, very good in asking open question. Could you tell me more about this Marfan syndrome? The patient may tell you everything, and so you will save your time. If she forget to ask, or if she forget to mention any point, you have to ask by cross question. When was the last consultation? This patient seemed to be not following her GP, her specialist. Very good. The last visit was since 2 years. It was so far since the last visit. She may have a change in her heart function. Okay. When was the last consultation with your eye doctor? Also 2 years. As you know, the Marfan syndrome will have an effect on the heart and the eye and the joint. There will be laxity on the joint of her body. Okay, I think the patient information left on Marfan syndrome on the group. When was the last consultation with your Pona John doctor? Also, she will say 2 years. Any medication for that? She will say, yes, I took 2 types of medication, Ramipril and Adderall. Any patient with Marfan syndrome, she took these drugs The ARBIS and angiotensin receptor blocker drugs, angiotensin receptor blockers like ramipril and the beta blocker, and this is to control the heartbeats and to control her blood pressure, not to have a tear or a rupture if she has any aneurysm of the aortic arch. So most of the patients of Marfan syndrome will go on these drugs. Any surgery, sometimes the Marfan syndrome may need surgery in the aortic arch. Any surgery for that, she will say no. How will control? She will say, I am very good. I am okay. No problem at all. I don't have any complaint. How do you feel right now? It is also give the same mean. Have you ever been pregnant before that one? She will say no. I hope to become pregnant. Could you tell me more about your period? You have to ask here about the gynecological history to know the last menstrual period. She may be pregnant right now, so you have to ask about the last menstrual period. She would say my period is regular every 28 days and there was normal amount, and my last one was 7 days. So ask open question. Could you tell me more about your period? Could you tell me more about your period? This is an open question. She may say everything about her period, even the last menstrual period. If she didn't mention the last one, you have to ask specifically about the last menstrual period to exclude that she is pregnant right now. She is 28 years, so you will ask about the cervical smear. Contraception, you have to mention and to ask about the contraception. Do you use any method of contraception? And she may say yes, but I wanted to stop. You have to ask about which type of contraception. She will say condom. Okay. Then you will go the remaining template of her history, the medical history, the surgical history, the drug history, whether you started to take folic acid. Any patient planning to become pregnant, she should use folic acid, 400 microgram, 3 months before pregnancy. Any allergy, any smoking. Social history is very important here to ask about her partner. And as you ask it, I know that you asked it very well, but it was very late. You may forget at this point. So if you go systematic, you will not forget any point. In the social history, as we used it, we will ask about the partner. Okay, what do you do for a living, and with whom you are living? Do you have enough support at home? So you will remember her partner. Okay, you have to ask about the partner, whether he has Marfan syndrome or no. She may say no. Have he ever tested for that? She may say yes, he tested for Marfan and he was normal. And because this will be make a difference in counseling her about the effect of her baby or the baby outcome. Then we ask about the psychological history as we used to do, family history also of any problem at all. And do you want to add anything? Thank you for sharing this information with me today. I wanted to examine you, examination as we used to do, template. I want to examine you the presence of chaperone, if you don't mind, for your pulse, blood pressure, and temperature. Then after taking the history, what we will do? Yes, we will give my opinion, our opinion in the preconception counseling. Yes, Mary, from your history, this patient is not follow her specialist regularly. So we have to refer her to her specialist doctor to see whether her heart function is normal or no. So from your history, I strongly advise you to continue on reliable method of contraception, as I wanted to arrange appointment with your heart doctor to check your heart, and you may be offered an scan on your heart called echo. Also, I want to book appointment with the eye doctor and the bone and joint doctor. Mary, I want to also to refer you to the genetic counselor to talk with you about your disease and the possibility of passing the disease to your baby. And you have to explain here that is inherited problem, and this problem may pass to her baby. This is a test called pre-implantation genetic diagnosis, where your egg and the sperm of your partner will be collected to create the embryo, and this will be in the lab, and only the healthy one will be implanted again. The unaffected one will be implanted. This is called pre-implantation genetic diagnosis. It will be done for the patient before pregnancy. if the patient came for pre-conception counseling and she has genetic problem like Marfan syndrome. This patient is at a risk to have a baby 1 in 2 with Marfan syndrome. So she may be offered this test, pre-implantation genetic diagnosis. We will do IVF baby, and this by taking her egg and the sperm of her partner, create the embryo in the lab, and only the unaffected one will be injected back or implanted back in her. This is called pre-implantation genetic diagnosis. And according to the NHS, H1 with Marfan syndrome will be founded only for one baby, one unaffected baby. Okay. Also, you will be offered the folic acid 3 months before conception, and this to decrease the risk for your baby to have neural tube defect. All of this should be done in the pre-conception clinic. Regarding your drugs, you take, as you mentioned, you took 2 types of the drug. The ARBs, the one angiotensin receptor blocker, it's not preferred in the pregnancy as it may affect the kidney of the baby, and so you may change it to a baby-friendly drug after discussion with your heart doctor. So if the patient is taking any angiotensin receptor blocker or angiotensin converting enzyme blocker, the ACE inhibitor or ARBs blocker, so this drug should be stopped before pregnancy and changed to a baby-friendly drug. And this will be after discussion with her heart doctor. Regarding the beta blocker, it is safe to be taken, but it will affect the growth of the baby. She will be offered the growth scan. So the angiotensin receptor blocker not preferred in the pregnancy because she will affect the kidney, will decrease the amniotic fluid around the baby, and after that the lung of the baby also will be affected. So we will not prefer this ACE inhibitor or ARBs during the pregnancy, and so we have to change it before pregnancy. Regarding to the beta blocker, it is safe to be taken during pregnancy, but it will may affect the growth. So will follow your baby by the growth scan. So this is the most important point in this task, to tell the patient about your opinion and what you want to do for this patient. Refer her to her heart doctor and the bone and joint doctor and the eye doctor. Refer her to the genetic counselor to talk about the possibility of passing the problem, and she may be offered pre-implantation genetic diagnosis. Give her folic acid. Stop the medication that is not suitable during pregnancy, like the angiotensin receptor blocker. Is it okay? She will say, okay, doctor. Now you will take her through the course of pregnancy in the Marfan syndrome. Okay, after correcting all the above, so when this patient become pregnant, you have to tell her what will be done when she will be pregnant. During the pregnancy, there will be extra load in your heart, and which lead to some heart problem. Your heartbeat become more faster and become irregular, and the heart may fail to pump the blood to your body. And the aorta, which is the main artery carry the blood from the heart to the rest of the body, may become enlarged and ballooned, and this is called aneurysm, and may tear out and called dissection. It is very risky for you and your baby. Also may have clot in the leg or in the lung. There will be extra load on your joint, and you may have backache. Your baby may grow smaller than expected, and you may be delivered before the due date. It's called preterm labor. This is the lay language of the SGA, and this is the lay language of the preterm labor. Your baby will be delivered before the due date. And as this is inherited condition, so it may pass to your baby by the chromosome. What is the chromosome? You have to mention the lay language of the chromosome. It is a thread-like structure in our cells, contain the genetic material which inherit from our parents. And is it as it is dominant disease, and this means that you have to mention what is dominant. This means that the person only need one gene to have the problem. So the risk of your baby here, it is about 1 in 2, and you can draw. You are Marfan syndrome and it is autosomal dominant, you will draw, and your baby, your partner don't have Marfan syndrome, so the risk of your baby will be 1 in 2. If her partner also have Marfan syndrome, so the risk of the baby will be 1 in will be 3 in 4. So your care will be under a group of doctors, which include the obstetrician, the heart doctor, the eye doctor, the bone joint doctor, a genetic counselor, and genetic and specialist nurse. You will have frequent visit and frequent checks. You will have the routine test, the Down syndrome screen, dating scan, anomaly scan, and the growth scan. All this have to be mentioned. And you may be offered during pregnancy. This is very important to mention here. You may be offered here a special test called the needle test to check whether your baby have the problem or no. So before pregnancy, she may be offered the pre-implantation genetic diagnosis. During her pregnancy, she may be offered a test called needle test, and this will be after her consent because there is a risk of miscarriage about 1 in 100. And you explain the needle test. What will be the needle test? Needle test, it will be a needle introduced through your tummy under anesthesia and ultrasound guidance to collect a small amount of the water. This is called amnosynthesis after 15 weeks, or a small amount of the blood in the link between you and your baby. It's called conic blood sample to be tested for the genetic material. Regarding the decision, regarding your delivery, the decision will be agreed between the team and you. If your aortic arch is less than 4, you may have vaginal delivery. If more than 4, you will have cesarean section. And this will be in a consultant-led unit, and you will be given pain relief option. You will shorten the second stage. You will monitor the heart rate of your baby. You will not be given methargine because it may increase your blood pressure. After the delivery, there will be a baby doctor, and you breastfeed your baby, and you will give you appointment for contraception, and you will be seen again by your specialist. Do you have any question? I will give you now patient information leaflet and a link of support group. Okay, the patient with genetic problem, you have to give her link of support group and the patient information leaflet to read. I know this is a long scenario, Marfan syndrome, a long information, but with repetition, it will be fixed in your mind. And with practice with your partner, you will not forget any point.
Hello, Dr. Ali.
Yes, Dr. Asina.
Yeah, one question. Shall we offer preconception MRI for spine and joint that is involved in?
Yes, you may offer that. In also in the preconception, the bone and joint doctor may offer you a special scan called MRI or joint. Okay.
Thank you.
Hello.
Dr. Fernandez, how are you?
Hello, Assalamualaikum. Walaikum Salam. How are you?
Fine.
Dr. Ali, one question is that this patient came before the pregnancy. So if the aortic fluid diameter is more than 4, the pregnancy is contraindicated. So
yes.
I will tell her, yeah, because there is a risk risk of death is about 50%, I think.
Yes, if in the note,
yeah,
in the note written there that the
root diameter is
4
so
so
in this condition, I will tell her if the root diameter is more than 4 centimeter, she will continue contraception till she had surgery, and then she will become pregnant.
Yes, if she the root diameter is more than 4, pregnancy contraindicated. As with patient the previous patient with also here the pregnancy is contraindicated. The patient with pulmonary hypertension and the ejection
I have to mention this is very important to mention.
Yes, so we have to mention that we not refer the pregnancy in this situation because the pregnancy will be risky, and you have to mention what will be her risk. So we will refer you to your specialist doctor and to see what can be done for you, and refer her to the consultant like that.
Yeah.
Okay. Thank you, Dr. Fernandez.
Welcome.
Any more question? regarding this task?
Dr. Ali, sorry, one question.
Okay, Dr. Asina.
Yeah, if such case she came with the normal heart echo, everything, shall we mention you are at risk of aortic aneurysm in a pregnancy, as she's and will tear and like that, as heart echo, everything is fine?
Yes, even if the heart function is fine and the echo is fine, it may deteriorate at any time during pregnancy. So you have to tell the patient, and she have to take the risk. This will be a patient safety, will be considered patient safety. Even if the function of the heart is now is normal, it may deteriorate during pregnancy, and there will be may be like this and this and this.
Okay, yeah, thank you.
Okay. So we will go to the next one. We have ulcerative colitis. Okay, we can want to share.
Yes, Dr. Ali.
Okay, Dr. Shaimat.
I can share. Yes. Okay.
Yes. Before I forget, I think Marfan syndrome came before in the recall in the exam. Marfan syndrome. Okay. Okay, Dr. Shaimat, I will adjust it now. 2 minutes for you.
Okay.
Start 2 minutes.
Dr. Ali,
Yes.
I'm sorry, sir, to interrupt, but did we mention blood thinning agents in case of Marfan syndrome?
Mention what?
Blood thinning agents.
Blood thinning.
Anticoagulants.
I think, let me confirm. Sorry, Dr. Shaimat, let me confirm.
Okay.
This patient of Marfan syndrome, we said she may, regarding the effect, okay, you may have a clot in the leg on the lung. So regarding her antenatal, we didn't mention that, but yes, it's a good point from you, Dr. Ansar, that we have to mention that she may take blood thinning agent during this pregnancy, because she at a risk to have a blood clot in the leg or in the lung. PTE risk assessment. Okay, thank you, Dr.
We
Ansar.
will start from I'm sorry, sir. Last point. We will start from where?
Really, in the patient information leaflet of Marfan syndrome, they didn't justify or didn't specify a gestational age to start from. I think this patient, it will be done all first VTE risk assessment, and she may start from the beginning of the
What, sir?
Okay,
I'm sorry,
yes, we will do VTE risk assessment for any patient in the antenatal care. We will do in the booking visit. We will do the VTE risk assessment, and she may start from the beginning of pregnancy.
Okay, sir. Thank you. I'm sorry for interruption.
Dr. Ali, excuse me. According to the guideline, this if it is a cardiac disease, then it will be intermediate risk. So if it is intermediate risk, we have to start from 28 weeks, isn't it?
If you consider this is a medical problem, any patient with medical problem will start from 28 weeks.
Yeah, cardiac disease. They mentioned cardiac disease. Yeah, in the guideline.
Yes, I know this is in the guideline of VTE prophylaxis, but specifically for the Marfan syndrome, I am not sure. I'm not sure it will be from the start of the pregnancy or from 28 weeks. So when you in this scenario or in this condition, if you're not sure from the VTE, you can say that we will do VTE risk assessment, and you may be given nothing. You may be given, and you will find this in many scenarios, like the coming one, ulcerative colitis. Also, you may be given blood thinning agent.
But it is cardiac disease. We know it is Marfan syndrome is cardiac disease, isn't it? So as a whole, guideline mentioned that cardiac disease. So
yes, cardiac disease.
Yeah, it makes sense, isn't it?
Yes.
Thank you.
You're welcome. So, Shaimaa, can we start? I will adjust it at 10 minutes now.
Yes, okay, Dr. Ali.
Okay, start please.
Okay. Hello, I am Dr. Shaimaa at the ST5 in the antenatal clinic. May I confirm your name and age, please?
Yes, my name is Mary Jean, and I am 25 years old.
I think this is the other slide, Dr. Ali.
Yeah? None?
Dr. Ali, I think this is the case 9.
Yes.
Not 10.
Yes. Sorry. Yes, okay. I'm Sarah Paul, and I am 22 years old.
What would you like me to call you?
Call me Sarah.
Nice to meet you, Sarah.
Nice to meet you, doctor.
Sarah, I came to know that you are pregnant and you have a condition called ulcerative colitis, and you come to book your pregnancy. Am I right?
Yes, doctor.
Sarah, any special concern or expectation you want me to address?
No, doctor. I want to be sure of, about this drug I used. I use a drug, from my note to control my disease. And I wanted to know the effect of this drug on my baby. And also I wanted to know how will be my plan for pregnancy.
Okay, Sarah, before I address your concern, would you mind if I ask you some few questions to know more about your condition?
Okay, doctor, no problem.
Sarah, at first, can you tell me more about your condition, this ulcerative colitis?
Yes, I have this problem since 4 years when I has cramps in my tummy and some loose motion, and sometimes I pass blood with the stool. So, then I went to my specialist. He diagnosed me with this problem and start to give me drug called infliximab. Since I take this drug, my condition is controlled.
Yes. When your last visit with your specialist doctor?
It was since 2 months.
I mean, just he knows that you are pregnant.
Again?
Your specialist doctor know that you are pregnant now?
Yes, I informed him already.
What he advised you?
He said no problem from taking this infliximab, but I have to come to you and take your opinion.
Okay. You have any? Do you feeling well right now? Any pain? Any passage of blood
Yes.
or mucus right now?
No, not all, doctor.
Okay. As regards this pregnancy, I understand this is your first pregnancy. Am I right?
Yes, this is my first one.
It is planned one?
No.
Yes. And you are happy to content?
Yes, it is welcome, doctor.
Did you start? Did you take the folic acid?
Yes, I started to take my folic.
Yeah, since you are pregnant.
Yes, when I started my pregnancy, I started to take this one.
Okay. How you far during this pregnancy? How far you are?
I think now my period since 14 weeks.
I think you come late for booking. Is there any issue for late coming for booking?
No, doctor. You know my job, and I am a teacher, and I am a little bit busy, so I didn't have time to come. But I will come after that, and I will follow.
Okay. I am happy that you will follow. Okay. Coming now to the point that you have ulcerative colitis, do you have any other problems that you follow with your GP?
No, at all.
Any other medication you take other than the infliximab?
No.
Any allergy?
No.
Any family history of concern you want to share with me?
No.
Sarah, do you smoke?
Occasionally.
Drink alcohol?
No.
Any recreational drugs?
No.
Okay. Thank you, Sarah, for sharing this information. Do you feel that any other information is important for me to know?
No, doctor.
Okay. Sarah, coming to the point that this is an unplanned pregnancy, but you are happy to continue. The first thing I should advise you later on to take a reliable method of contraception. Would you taking any contraception?
It was a condom, but it broken, and so I get pregnant.
Okay, Sarah, really condom is very good in preventing sexually transmitted infection, but it is not good as a reliable method of contraception. After pregnancy, we will give you a good advice about this.
Okay.
Coming to the ulcerative colitis, Sarah, most of the women with ulcerative colitis have a healthy pregnancy and a healthy baby. But since you are having taking this drug, infliximab, usually this drug we are stopped during the pregnancy from about 20 weeks. That's why I'm going to refer you back to your specialist doctor who can prescribe for you another remedy to stop this treatment and prescribe for you another treatment at this time. The second thing, Sarah, I want to tell you that during this ulcerative colitis, there is some women may have increased risk to having a delivery of the baby before the due date, and this is more common if you have active disease during the pregnancy. There is also chance that the baby may grow smaller than expected. For that, you can be offered serial scans for the baby. And Sarah, now coming to your care during pregnancy, your care will be under a group of expert doctors, including our consultant, a specialist nurse, a specialist midwife. And right now we are going to make for you some blood tests Since you are 14 weeks, Sarah, you are mid ultrasound screening for Downs. We will order you some blood tests to check your blood group, your hemoglobin, some virus such as the hepatitis B, the HIV, the syphilis, the rubella, and some tests to screen for Downs, such as the beta HG and the BAPE. Are you following me, Sarah?
Yes, doctor. Yes, I'm following you.
And also, Sarah, during your antenatal care visits, you may have more frequent visits. You may have at some point to assess your risk of for the venous thromboembolism. At some point, you may be offered a blood thinning agent. Also, your nutritional, such as vitamin B12 deficiency, vitamin D deficiency, all this will be screened because it is more liable in your condition. Sarah, as regards your delivery, normally we aim for a vaginal delivery, and the decision will be taken between the multidisciplinary team and you. But in case you have active disease, in case you have any disease related to your back passage at this time, we can recommend a cesarean section. And in your case, if you have a cesarean section, it will be by a senior doctor, because you are more liable to some problems, because you may have much scars inside your abdomen. After delivery, Sarah, since you was taking this drug, the infliximab, which are called the biological drugs, your baby should be advised to not to take a live active live vaccine, such as the BCG vaccine or the oral polio vaccine, for at least 6 months. And the baby doctor will be informed about this. You will be offered adequate contraception. You can restart your infliximab after delivery if it is the only drug that suits for you. And you will give an appointment with your specialist doctor after delivery. Sarah, any other concern you want me to address?
No, doctor. Really, you cover all my question in my mind.
Sarah, now I will give you this patient information leaflet to know more about your condition and this support group.
Okay.
Okay. Thank you, Dr. Ali.
Thank you, Dr. Shaima. Excellent, Dr. Shaima. You cover all the points and good in communication with the patient, except only you ask me one time for checking understanding. It may be more better if you ask me 2 to 3 times. But otherwise, you really cover all the points and you did very well in this task. I even think that you will forget the baby will not take life attenuated vaccine if she continue the infliximab till the 3rd trimester, but you managed to mention that will be a very important point in safety. And you say 2 jargon during your consultation, like multidisciplinary team. In the first time you said a group of a group of expert doctor. In second time during the delivery, you said that the decision will be agreed between you and the multidisciplinary team. Better to not to mention multidisciplinary team, say a group of doctor. And the second jargon, it was abdomen. Don't say abdomen, say tummy. You said there will be, I think, adhesion in your abdomen. It will be a tummy. Otherwise, very good, excellent. I think if you have this task in the exam, you will, from my opinion, you will pass in this task.
Thank you, Dr. Ali.
Welcome, Dr. Shaima. Coming to the module of answer, as we used to do a template for any task. So, hello, I am Dr. Shaima. I'm Dr. Shaima, one of the senior doctor in the antenatal clinic. May I confirm your name and age, please? You may mention the clinic. If you are in the antenatal clinic, mention the clinic. If they said in the question or the instruction outside you are the ST5 and you in the antenatal clinic and you are about to see Miss Mary, Miss Sarah. So this is a situation awareness. So you have to mention, I am Dr. Ali, one of the senior doctor in the antenatal clinic. If the instruction outside, you are in the subfertility clinic, if you are in the gynecology clinic, if you are in the early pregnancy clinic. So you have to mention that, and this will be situation awareness. So I'm Dr. Shayma, one of the senior doctor or the ST5 in the antenatal clinic. May you confirm your name and age, please? Hello, Sarah. I understand that you are here today to book your pregnancy. Am I right? I understand also that you have ulcerative colitis. Am I right? Here, the appreciation, very good, Dr. Shayma, and mention that she is late to book her pregnancy. So it's also very important in situation awareness. This patient at 14 weeks. This patient 14 weeks. So it is too late to book her pregnancy. This is not the standard in the UK to book the pregnancy at the 14 weeks. Usually the patient will come early to book her pregnancy at 6 to 7 weeks like this. But 14 weeks to book pregnancy, I think this will be too late. So you have to explore. There is any other problem prevent her to come early to book her pregnancy, and you managed to mention that. Very good. So not here reasonable to appreciate that she come to book her pregnancy. As we said before, we have template to appreciate every patient, but here we're not reasonable because she come late. How you will appreciate her? So we'll go directly to the agenda. Before we discuss the best management plan for you, I want to ask you some question to know more about you. Is it okay? She will say okay. Then analysis of her present illness. As you said, ask open question. It will save your time and give you the highest mark. To tell me more about your problem, she will say everything. If she forget to mention, so you have to ask specifically about this point. When was the consultation? Any medication for that? She will say infliximab. Good. You have here to focus on the infliximab, how to stress on the infliximab. If you want to keep it till the antenatal care, is it okay? If you have to stress on infliximab here to finish and to before you forget, it will be okay. So it will be for you to mention and to say what is the effect of the infliximab, either here in the analysis of the present illness or there in the antenatal care, here antenatal care. From my opinion, tell here or say here because you may forget. And if you forget, it will lessen your mark during for safety and the applied clinical knowledge. Good. Infliximab is a good drug to control your disease in pregnancy, and the studies say that it is safe, but you will have to stop it at 22 weeks, and this is where, but after any drug will be stopped, any drug will be continued, and this will be after consultation. This will be safety point after consultation with your specialist, because after that time, it may pass to your baby and affect your baby. If you have to continue on the infliximab till the 3rd trimester, your baby shouldn't take a life attenuated vaccine for 6 months. This life attenuated vaccine like MMR, oral polio, and the BCG vaccine. Okay, so you have to mention here, or you can keep it there in the antenatal care. From my opinion, I used to tell here from the start not to forget. So I will tell what the effect of the infliximab and when to stop after consultation with her specialist doctor. And this is because it may pass to her baby, and if she has to continue on the infliximab, her baby shouldn't be given life attenuated vaccine for 6 months. So if you forget to mention this, her baby after the delivery, it will be okay, you will be safe because you mentioned it already. The examiner has a sheet by the point in the patient safety and in the applied knowledge, and he will mark. So you mention infliximab have to stop at 22 weeks, he will mark and give you your mark. You mentioned that if you continue till the 3rd trimester, the baby shouldn't take life attenuated vaccine, he will do the mark. either you mention here or in the antenatal care. Am I clear? Okay. So how will control this medication? How will control this medication? She will say, okay, when was the last consultation? How do you feel right now? This is the analysis of the medical illness. Then you will go to the obstetric. Could you tell me why you booked late your pregnancy? Why you came late to book your pregnancy? Any problem at home? This will be also patient safety and situation awareness. Okay, is it planned pregnancy? She will say no. Are you willing to continue that pregnancy? This is the second question after saying no, it is unplanned pregnancy. She will say it is welcome. Okay, in a scan, in a test, because she come at 14, she may do before dating a scan or viability scan. Any test done before, she will say no. Okay, then ask about her LMP to know the gestational age. She is cervical smear because she is 20. I think it's more than 25. We can 22 years, so it will not be relevant here. No, not relevant to ask about cervical smear. Here it is unplanned pregnancy, so you have to stress on the contraception, as we said before. She will say condom. Okay, condom is a good option for contraception and also prevent sexual transmitted infection. But as you know, you may forget or it can broken. So it's very important to use a reliable method of contraception after this pregnancy, not to have any unplanned pregnancy again. So any unplanned pregnancy, you have to stress on contraception, and Dr. Shaima managed to mention that. Medical history in a surgery. She made surgery for ulcerative colitis before. She didn't make any surgery before. Any allergies? What about the folic acid, smoking, and social history? The partner, the support at home. I think you forget psychological history. It's very important, Dr. Shaima. It's very important to screen for the psychological problem by asking her the two holy question. In the last 4 weeks, have you been bothered by feeling low? The last 4 weeks, have you been bothered by feeling loss of interest in doing things? And family history. And do you want to add anything? Thank you for sharing this information with me today. I want to examine you as we used to do in the presence of chaperone. If you don't mind, here it will be early pregnancy, so pulse, blood pressure, temperature. You take here through a course of the pregnancy of the ulcerative colitis patient and the effect of the ulcerative colitis on the pregnancy and the effect of the pregnancy on ulcerative colitis. Most of the women with ulcerative colitis will have healthy pregnancy and healthy baby, especially if the conception happened while your disease is quiet during the remission phase. However, some women may have miscarriage, her baby delivered before the due date by the Lee language, her baby is smaller than expected, and you managed to mention all of this, Dr. Shaima. Good. Anemia, clot in the leg on the lung. She may need hospital admission. So your care will be under a group of doctors, not multidisciplinary team, as we said. And you have to mention what is the multidisciplinary team. It will be obstetrician, doctor specialized in the intestine and stomach, or you can mention doctor specialized in the ulcerative colitis, dietitian and specialized nurse. You will have frequent visit and the frequent checks, including the routine test. And we all know what is or what are the routine tests: blood group RH, anti-RBCs, and the complete blood count, HIV, hepatitis B, syphilis, rubella, and urine infection. You will screen for Down syndrome, and here will be by the serum test. Because you are late, the combined test will not be relevant here. It will be the by serum test, the quadruple test. You will be offered dating scan, anomaly scan at 18 to 21, and the growth scan from 28 weeks. We wanted to confirm this 28 or 24, as we said before. Assess the risk of the VTE you may be given. Yes, here also I remember in the guideline of the VTE prophylaxis, they mentioned ulcerative colitis. It will be one of the medical disorder which will be given prophylactic blood thinning agent or prophylactic heparin from 28 weeks. So you can mention like this: we will assess your risk to have a clot, and you may be given a blood thinning agent from 28 weeks. This patient, if on steroid or calcineurin inhibitors like cyclosporine or tacrolimus, she will need OGTT. But here she is not. She said no in other drugs. So no need for the OGTT. If she is also in the steroid or cyclosporine, she will need OGTT. Regarding your delivery, as you said, Dr. Shaima, it is early now to decide how and when you will have your baby, but we will aim for vaginal delivery, and unless there is indication for the cesarean section. This will be in a consultant-led unit, and you will be given pain relief option except Bethadine. Also, this patient written in the TOG not be given Bethadine, but here, because Bethadine may cause constipation, and in this, if have constipation, she may exacerbate her problem. So if you mention that, it will be excellent from you that you read this talk, and you mention that the patient not take also Bethadine. We will monitor the heartbeat of your baby. If the patient takes steroid, she may need a stress dose of the hydrocortisone. Very important safety point. But if the patient taking the steroid for 7.5 milligram for 2 weeks or 5 milligram for 4 weeks, so in this case, this patient will need a stress dose of hydrocortisone 100 milligram every 6 hours. And you will continue your medication. After delivery, there will be a baby doctor to check your baby, and you are allowed to breastfeed your baby, and they give an appointment for contraception. You will not be given non-steroid, as it may flare the disease, as mentioned also on the doc. If you mention, it will be okay. If you forget, it will not be relevant so much. As we said, you have to mention the life attenuated vaccine. If you said it before, if you mentioned it before, it's okay. If you wanted to keep it till the end, also it will be okay, but you will be at risk to forget or the time not allow you, so you will lose your mark. So if you manage to tell or to mention that in the start, it will be very good, and at that time you will be safe. No life attenuated vaccine for 6 months if you continue on the infliximab till the 3rd trimester. You will see again by a specialist doctor and to check your treatment. Any questions so far? I will give you now patient information leaflet and the contact number in case of you have any question. This is the table about the biologics in pregnancy and when to stop these biologics. This is a talk of biologics in the pregnancy 2016. Okay, this talk says that because there was a debate when we was studying this case about stopping of the infliximab. I want to stop. Some said at 16 weeks, some said at 22 weeks. It is 22 weeks here, written clear in the talk that infliximab to be stopped at 22 weeks. Also, the British Society of Rheumatology, there is also a talk about or there's a guideline published from the British Society of Rheumatology mentioned all of these biologics, and also the infliximab have to be stopped at 22 weeks. And the Intracept can be continued till the 3rd trimester. 32 weeks is the beginning of the 1st trimester. 32 weeks. The only one who can continue till the end of the pregnancy, it is the last one. It is called certolizumab. This one can be continued here. Can be continued if you read here. Safe to continue here. The star. This means that safe to continue through the pregnancy. Okay, this can be applied clinical knowledge if you are in structured discussion task, and he asks you about the most suitable one to be continued during pregnancy. It will be this one, but infliximab have to stop at 22 weeks. So, any question?
Yes, Dr. Ali.
Yes, Dr. Fernandez.
Regarding the mode of delivery, the aim is vaginal delivery, but episiotomy must be avoided. And if there is any perianal region, then may consider cesarean section. Is that?
Again, the mode of delivery is vaginal delivery and what?
But episiotomy must be avoided. And if there is any perianal regions, then cesarean section may be considered in this case of ulcerative colitis. Yeah.
If any emergency arise?
No, not emergency. in case of the aim is vaginal delivery, but the episiotomy should be avoided in these patients. And if there is any perianal lesions, then a cesarean section may be considered. And if the cesarean section is considered, it should be done electively because there is a risk of adhesions and the bowel damage.
Yes, they mentioned that in the talk. If there is
Yeah.
high risk for the emergency section, this patient may be at a high risk to have an emergency section, so it will be risky more than the elective surgery because there may be an adhesion from the ulcerative colitis. So it should be done by experienced one, and the elective cesarean section should be considered in this situation. Yes. Yes, very good. Very good, Dr. Ahmed.
Thank you.
Welcome.
And this also should be mentioned that if the antenatal low molecular weight heparin is started, so it must be continued for 6 weeks.
Yes, excellent, excellent. If we start the low molecular weight heparin from the 28 weeks, so you have to continue for 6 weeks after the delivery of your baby. Excellent.
Yeah. Thank you.
Dr. Ali, thank you so much. I'm Dr. Anila, and I just have one last query about, you said that the thing that if somebody has been taking, mother has been taking biologics and about this 6 months, withholding of the vaccination in the neonate. So what I understood from your account is that if you are able to stop it, like infliximab at 22 weeks, then there's no need to withhold the vaccination in the baby?
If we stop at 22 weeks, no need for withholding the vaccination. The baby can take her vaccination immediately. But
so there are some scenarios. Yeah, there are. Sorry to interrupt you. Yeah, say please.
Okay, I am hearing you. Yes.
Yeah, so there are some scenarios where they say that the patient came at 28 weeks and she was taking infliximab or any other biologic that needed to be stopped at that time. Then in that case, we will mention. So what about the cases? Will they be giving us cases in between the gray zone between 22 to 28?
Yes. If the patient between 22 and 28, from my opinion, it will it still now not come to the third trimester, so no need to hold the vaccination. The guideline or the talk is clear. If the patient take it in the third trimester, so we have to hold the vaccination for 6 months. The concern of this, or why we have to hold the vaccination, because the drug will pass to the baby and it will be still in the blood of the baby, and it will lower I think it will lower the immunity of the baby, so the life attenuated vaccine will not be reasonable to be taken. But if it take early in pregnancy before third trimester, the baby will excrete, and it will no mention or a small amount will be in the baby blood. So no problem to take the life attenuated vaccine.
Thank you.
Welcome, Dr. Anila.
Dr. Ali, please, sir.
I have one question, please.
Yes, Dr.
Hello.
Intisar.
Yes, sir. I'm sorry, it's a little question. I'm sorry. Rubella is mentioned in every booking. Isn't it now? It is not done as a routine at booking.
Yes, not done now. Yes, in some areas of the UK, not done now, including England. England not done now the rubella. I think Ireland is still doing rubella, Scotland, but England no need, no more rubella.
Okay, so we will ignore it. We will ignore, or it is safer to mention it.
Yes, it's safer to mention. We used to mention it. Yes.
Okay, sir. Thank you.
Okay, welcome.
Hello, I have one question, please.
Okay, Dr. Hasina.
Yeah, there is mentioned then if we should start infliximab after the delivery, but if more than 16 weeks, then there is chance then anaphylaxis. If we stop at 22 weeks and we need to start after delivery, that is more than 16 weeks. So there is more chance. So anaphylaxis they written in the BNF and also an article.
In the recall, yes,
So
in
what
the
should
recall
we
they
mention about
bring,
that?
yes, in the recall they bring the BNF of the drug and they give it to the candidate, and there will be written there, this drug should not be taken again if it stopped more than 16 weeks, because it may lead to hypersensitivity or anaphylaxis if taken after 16 weeks of stoppage. So if we stop now at 22 weeks, we didn't mention that you will come back to the infliximab. No, she will be seen by her specialist doctor, and he will see what is the suitable drug for her. We are not a gastroenterologist to manage ulcerative colitis, and he is the one to manage, and he is the one to give her the patient the suitable drug.
Yeah.
Okay. Another question? Okay, thank you all my colleague. We will stop here. Inshallah, next week we will do labor and delivery and postnatal. Inshallah. Okay, see you next week. Inshallah.
Thank you very much, Dr. Ali. Thank you for your time.
Thank you, Dr. Ali.
Thank you,
Thank you
doctor.
for your time. Thank you for your time. Thank you.
Thank you, doctor.
Dr.
Thank
Ali.
you, doctor.
Yes,
Dr.
Dr.
Ali,
Ansar. Yes.
I'm sorry, sir. Can I ask about the fee of the course? I'm sorry.
Yes, you can ask me in private, please.
Okay, sir. Okay. Thank you,
Okay,
sir.
thank you. Thank you, Dr. Ansar.
Thank you, doctor.
Thank you.